to our Fireside Chat this afternoon featuring Professor Yawei Zhang. Just returned from some work in China, and so we are very grateful to have her here this afternoon. Just to bring you up to date on a couple pieces of information from Yale-China. We have another Fireside Chat, so far our last scheduled for the year, on April 15th with Nick Fritsch. So it's been quite a year. We've had a number of Fireside Chats ranging from economic to health issues to just about everything in between. And this afternoon we continue on the health side of things, but with a look toward the environment in China. My name is Mike Pakovich. I'm the Interim Director of Health Programs here at Yale-China, and I'm excited that Yawei is here. But the first thing I want to do is set the stage a little bit for to get an idea of some of the issues that are going on with pollution in China. So first of all, just a few statistics. Everyone is probably well aware that China's population is 1.4 billion people, nearly 5 times the population of the US. Now I know this is, I shouldn't be doing this, but I'm going to do it anyway. Now, if everybody could just stand up for a moment. Okay, if you can imagine, this is the space of China. It's just about equal to the geographic space of the continental United States plus Alaska. So very similar in size to the US. However, there's a big difference in the amount of usable land in China because of the Tibetan Plateau, the Gobi Desert, the Taklamakan Desert. Huge parts of China are very sparsely inhabited or completely uninhabited. So, if we imagine this as the geographic area, I want everybody to just move over to this side of the barrier. Okay, just move over. Just move over. Okay, perfect. Perfect. Now you're starting to get an idea of the population of China in comparison to the land. Now imagine multiplying the number of you by about 4.6 and putting you all in the same place. Okay, thanks. Demonstration's over. The challenges facing the country because of the geographic size, because of the geographic limitations, because of the population size, and because of the speed of development are absolutely staggering. So let's see if this will work. While we'll be talking about air pollution in the next few minutes, I want to give you a little bit of information on the situation with other kinds of pollution in China. You can see the graphic there. Let me ask you, can anybody guess what the major source of water pollution in China is? And I wouldn't have known this.
It's not coal, I think.
It's not coal. That's just water pollution.
Metal.
Metal, good guess.
Fertilizer runoff.
Ah, good. Agricultural runoff. The runoff, the fertilizer, pesticides, etc., used in farming are the major source of water pollution in China. But then you can see from the graphic as well, 20% of the water withdrawn in China is used to mine, process, and consume coal, the dirtiest form of energy. That's really, really staggering. And then, because of this situation with the absolutely staggering amount of water pollution, farmers will often have two sets of fields. There's the one set of fields that they use for their selling, and then there's another set that they use for their consumption, on which they use cleaner water. Very interesting. So, Wang Dong, senior expert at the Chinese Academy for Environmental Planning, says this about China's development: it's developing too rapidly. It took Western countries 100 and more years to develop to this level. It took China just 30 years. And those of us who are from China or who have lived in China, we've seen this development firsthand. And it's staggering. It's absolutely staggering what's been done in the country. But it's been at a very large environmental cost. So here, as we get into Yawei's talk, I want you to notice, here's the air quality and pollution measurement, the key to the graph. So notice the colors. Just notice the colors. Notice that when you get to the orange color, 101 to 150, it's unhealthy for sensitive groups. When you get to that pinkish, reddish color, it's unhealthy for everyone. Purple is very unhealthy. The deep red is hazardous. I don't know how many of you, well, I know you're from Lanzhou, so you've had plenty of hazardous days. I lived in Beijing, and Chris Merck, our interim executive director, lived in Beijing for many years. We can think of many days when the pollution level was at the hazardous. So, I'm going to put up a graphic in just a second that I pulled down just about 4 hours ago. And what do you notice? Not a trick question.
Most of it's some kind of hazardous all over the country.
It's some kind of hazardous all over. Look at the amount of red. It's stunning. And you know, just below that is the orange. Look at the scarcity of yellow and even green throughout the country. And notice the concentration on the more developed eastern part of the country. It's a stunning problem. And as some of you know, the recent environmental expo that was put out called Under the Dome, which had some controversy as well. People are trying to highlight this problem and both do research to understand where it's coming from and what it's doing to the population. And the next step is to figure out ways that the country can change this regime while still keeping on the path of development throughout the country. So, with that in mind, that brings us to Yawei's talk this afternoon. She is an associate professor at the Department of Environmental Health and Sciences at the Yale School of Public Health, and she received her initial medical training in China, and she came to Yale for her master's in public health and later her PhD in epidemiology from the School of Public Health. She did a one-year postdoc fellowship at the National Cancer Institute and then joined the Yale faculty in 2005 in the School of Public Health. Her list of publications is impressive. The various things that she's been involved in both in China and in the United States is, you've done really well.
Thank you.
So, without further ado, and you can read her bio on the information more completely, but without further ado, I'm going to turn it over to you, Yawei, and move into the back so people can pay attention to you.
Thank you, Mike, for the invitation, and I'm really thankful for today being here to share with you some of the work I have been doing in China. Today, so the topic is environment contributions to pregnancy outcome. And I will use mainly the Lanzhou birth cohort study I'll be working with. And I will focus on two, topics we have been conducted in the birth cohort study. One is looking at the air pollution, another is passive smoking. So I think this is kind of like related to the current, the topic in China. And it's grabbed a lot of attention from the general population and even from the world. People all care about China's air pollution. So this picture actually I just took from Beijing when I visited 3 weeks ago. So this is one of the day, and I went there. I stayed for like about 3 weeks, and I would say more than 2/3 of the day it's like this. It's pretty amazing, but it's really worse. You can feel when you're outside of the breathing, you can taste, those kind of like some smell. It's really bad. And here is some, data from the New York Times published in 2013, and they said that air pollution linked to about 1.2 million premature deaths in China. And this came from the data from they call it disease burden around the world. They come up with a conclusion. And how much, this conclusion came from China's data, we really don't know yet. Actually, when they using those air pollution data linking to the human health burden, and mainly, using the data which conducted in the Western population, and all have the, majority of those studies has a very low level air pollution level. So there's really not much data from China where it has a high pollution level. And I think this, it's a current issue, which it's about, it's a documentary film did by the very famous Chinese journalist Chai Jing in probably just a month ago. And actually, they, quite a lot of people viewed this documentary film. But right now, they already being shut down in China. You cannot view this anymore. But I think it's already a big progress, in China. Before we wanted to conduct such like an air pollution study or even such type of film, they were never will be able to appear in any Chinese news media. But right now, at least they post there for a week. I think that's a big progress. And I think, in China, a lot of, government agencies, I also visited the China CDC, we call it equivalent to the U.S. EPA and here the NIHS, the Institution of Environmental Health Science Research. So they currently actually government put a lot of effort, asking them conducting nationwide studies looking at the air pollution, what's exact health impact from the air pollution. So I want to show you some, another issue, smoking pattern. So if we came from China, we all know if you go outside, you can always smell smoke, right? And the same thing right now. So when I went to China and we had I bring one doctor student, we went to Qidong for a meeting. And then we kind of both went to the elevator. And there's nobody smoking there, but it's very strong smell of smoke. And I asked her, there's a strong smell. I said, I didn't smell at all. So people are already used to, a smell of very strong smoke. So they don't even realize, actually in addition to the, the second-hand smoking, actually the third-hand smoking in China is very, serious as well. And here is the smoking pattern. You can see, I want to give you another one. This is from the United States and this from China. So there's three one I want to pay attention. This is, you can tell the total cigarettes per capita. And you can see from 1980s to 2010. So China is kind of like did not show any sign for decreasing. But when you're looking at the United States, sharp decreasing. And this figure and the symbol is this one. So when you see in China, the very high prevalence among men, but a very low prevalence among women. So which brought the issue, actually a lot of women exposed to secondhand smoking. So for, in the United States, you can tell both men and women, it's very similar, the pattern, the prevalence. So, and you can tell there's from both men and women, the pattern is decreasing in the US, but in China, there's still no sign for, showing the sign for decreasing. And I just heard they said, since starting from the summer, I think June 1st or something, will be a nationwide regulation. So all the public area, they're going to smoke free. So I don't know how that will be effective. Many places will follow that rule or not. But that's unless something we heard it's good. So that's kind of give you some brief idea about the air pollution and the secondhand smoking pattern. So I want to show you, China has a national birth defects monitoring network. They started back to the very early 1990s and running by the University of Sichuan University. And here is all the red dots. It's about their monitoring area, the network, the selected sample, the hospital location. This almost, you can see the representing the all of entire Chinese population. And here is the data I got from this network, and actually the guy who developed this the reporting system spent about 2 years working with us during the past couple of years, and he showed me this data. And I just want to show, because I will present you the congenital heart disease defects that we found in our study. And you can see that starting from the 1969 to 2009, there's a sharp increasing for the congenital heart disease defects among the Chinese babies. And all those, I want to show that this from the hospitals, their sampled hospital, there's total about like 783 hospitals. It's more than 1.3 million births in 2009, and which representing about like roughly 10% of all the newborn Chinese babies. And this, so we all know the birth defects depends on the rates. Really depends on when you ascertain those birth defects. This all came from, I'm sorry, I missed this. This is 28 weeks, sorry. Gestational age has to be more than equal to 28 weeks or more than that. And they include both, stillbirth and the legal termination birth. And they assessed within 7 days, after they were born. This all hospitals above county level hospital. And we all know like congenital heart disease defects, they have generally if you, the major severe, heart disease birth defects, and they can detect it, very early on using ultrasound. So if that's the case, and they will many pregnant women, they will terminate their pregnancy. So if before 28 weeks, they were not reported to the system. So they only report after 28 weeks. So that's also want to just give you some brief idea. When we do our studies, we ascertain the women's, for them, they came to the hospital for delivery. So our baby has to be, delivered, and then we ascertain this birth defects. So the number is much lower. If we considering those, they did early screening, probably the number will be much higher. And also more severe, the hot birth defects, they will kind of terminate it earlier. Yeah.
It looks like from about 2005 to 2008, it held somewhat steady. Is there any reason for that?
I'm not quite sure about that, but I would see, probably there's kind of like an introduction about the early screening for those defects they using ultrasound. And I was expecting that's the case. And here is, the kind of like some preterm birth baby, the number. Actually, China right now is ranked as the second, the country which has the largest number of preterm birth baby. I think it's a major thing is, the large population base, it's play a role. And we just, the second to the Indian rates, it's about like 7 to 8% of the preterm births. And I think another thing is, we have a lot more, preterm births because right now the current, the advanced technology in the, the medical care, and many smaller gestational baby could leave, unlike before, they cannot leave. So that's probably another reason. So here is the China birth cohort studies we have been working with, and one is from the Lanzhou, Gansu Province here, and one is from Shanxi, Taiyuan location. So we all know from China, this is the two worst air pollution city in China. And it's quite severe, Lanzhou is more related to the industrial city. There's quite a lot of major industries located in Lanzhou. And Taiyuan, coal mining is a big thing in Shanxi Province. So that's kind of two major places that I've been working with. And I also came from Lanzhou, which is my hometown, so that's kind of give me privilege, go there. To work with the people on this first cohort study. So this kind of this one I took by myself when I went to Lanzhou, I think 2 years ago. So it's actually a very beautiful city, and this is Yellow River just passed by in the middle of the city. And the two sides are mountains, so that's kind of all the air pollution kind of trapped there. It's hard to blow away. For Taiyuan, and they have a joke, Taiyuan's air and the garbage is all rely on the wind. If they have a strong windy, so the city will be much cleaner. And if not, they will kind of become very dirty. So that's kind of, it's pretty flat in Taiyuan. And I think there's, the two things very alike for the two cities. They're all famous with noodles, but it's different kinds. For Lanzhou, it's a stretch beef noodle. It's very famous. If you go to China, you can actually eat that in almost every single city. Right now, they have Lanzhou beef noodle. But for Taiyuan, they have another, they call it dao xue mian, using knife cut the, noodle, but it's very different way to make them. And also eating, type is very different as well. So for Lanzhou birth cohort, we carried out in 2010 to 2012. It's roughly about 3 years. And we recruited about 10,542 mother baby pairs, and we collected a very detailed questionnaire in terms of their lifestyle and other environmental exposures. And we collected their maternal and cord blood, and we also collected air pollution data from the local monitoring station. And for Taiyuan one, we started a little late in 2012, and until 2016, our goal is still 10,000. But so far, we already recruited 7,500 mother baby pairs. So for this one, we're still ongoing, and we collect almost the same type of information as we did for Lanzhou birth cohort study. Only additional one is that for this one, we also collected placenta samples. So that's the only difference. So this is a 2 birth cohort study. So today, so this one's still ongoing. We haven't analyzed the data yet. So I will present some preliminary results from the Lanzhou birth cohort study. So this is kind of some pictures we did. It's really kind of hard work. Involves a lot of physicians, doctors, and nurses to perform this cohort study. And within almost 3 years, we finished those 10,000 mother baby pairs, and a lot of questionnaire, very detailed. And actually, after they finish every single questionnaire, it's about 20 pages long. And they scan them and email to me, and I print it out here, and they send people coming over. So we did all those entering data, and right now claimed used for the data analysis. And all the blood samples they collected and processed right now, it's still stored in their the freezers, -80 freezer. It's still in China in their hospital. So actually, during this study performance stage, the hospital is in the kind of process building a new one and get rid of the older one. So the entire, the building, they kind of destroyed half of the building, give the space to build a new one. So they're using those another half still performing the, the everyday performance, and it's very difficult, during that time period. But right now they have beautiful hospitals and the entire floor for the research purpose, which is really generous, from the president. So, so this is kind of like just give you a rough number how we did it. We generally, are recruiting all the women coming to the hospital for delivery, and we restrict them must be, adults more than 18 years old, and their gestational age more than 20 weeks. And there's no mental illness, which give the ability to, talking with them, interview, get the data. And there's about during the time we did the study, they have about 14,000, baby pairs, mothers coming for delivery. We got a 73.4% participation rates. I think it's pretty good, for that large population study. And among those participants, there's about more than 85% of them are Lanzhou residents, so which is good. So if we do the air pollution study, we do not have the data for outside Lanzhou monitoring data, so we can only restrict it to the subjects who came from Lanzhou area. So regarding the we first look at the PM10 exposure and preterm births. So the reason is during that the before 2013, there's no requirement from central government asking for those local EPA station to reporting those PM 2.5. They only ask them to reporting to PM 2.10. So that's the only data we could get. But after right now, after 2013, this is kind of like a central requirement. They have to report it to 2.5 every day. So for the Taiyuan first cohort study for the future, we'll be able to ascertain the PM 2.5 relationship. So regarding the PM10 exposure and the preterm births, there's from the literature so far, there's only 12 published studies. There's 2 did in China, but the majority of them all based on the birth registry data. So we all know that there's kind of certain limitations related to using birth registry data, so they do not have very detailed individual information, so we cannot control some potential confounding factors. And on the other hand, the registry database, they only collecting the home address during the delivery. They ask, well, where is the home address? They will recording that. But there's no kind of like their work address, and if they moved during the pregnancy, they do not have those mobility data as well. So that's kind of the limitation from the registry database. There's do need, those cohort study has very detailed information. And all those previous published study, in addition to those, except for this 2 China study, their mean PM10 ranges from 13 to 90 milligrams per meter cubic, and so that's pretty low level. And I will show you, in our birth cohort study, what's the average, exposure level for our birth cohort study women. So also previous studies, the very few studies they have examined the association by preterm subtypes. So we all know that if baby delivered before 37 weeks of gestation, we consider them as a preterm birth. But we do know those preterm births are caused by different reasons. So some of them, maternal complications, they have to deliver the baby earlier. So that's we call medically indicated preterm births. But many of them are spontaneous. We have no idea what's the exact cause for preterm births. So that's kind of could be the different etiology profile. We need to distinct them to analyze whether they kind of all associate with the air pollution or not. And also based on the gestational weeks, we can define them as moderate preterm births or very preterm births. So which will be less than 32 weeks of gestation age. So it's not much studies has been looked at with those subtypes as well. So there do need more studies to look at the air pollution. So here is the map for Lanzhou, and we all know in China that when they see the city, they, in addition to including this kind of like a central city area, they also include the surrounding counties, which also belong to the Lanzhou city. but there's like 2 or 3 county and a couple district, like a 4 district, within this Lanzhou. And here's their population density in Lanzhou. You can see it's pretty much located in this central Lanzhou area. And when you're looking at our study population, pretty much matched with those, kind of like population densities. Majority of them came from this central area. And the air pollution monitor station, the location, the 4 monitoring location, it's just within those, the central area. So that's why we cannot really including the people outside of Lanzhou area. So we exclude them from the further analysis. This figure just show you, we're looking at the PM10 concentration, and you can see that, from the different season, and the spatial heterogeneity is not that big. It's pretty much similar, the whole city within each season. But the seasonal variation is huge. In the winter time, it's very high. Summertime is really low. But the spring and the fall time, it's kind of in the middle of them. So that's kind of, even though, the people at the beginning, actually, when we said we're going to conduct this first cohort study looking at the air pollution in Lanzhou, so that Lanzhou has a really high air pollution, level. How can you make a difference, among the population if they all came from the same place? But when you're looking at the big seasonal differences, you will, we have the confidence, all the women, they're not really kind of exposed to the same level. So the 10 months pregnancy, they could be more happen during the summer, less polluted time period. So they might have lower exposure level. So that's, just give you some taste about pollution level. Here, just to show you, some, we try to, when we're looking at try to figure out the exposure level for each particular person, and we use kind of 2 different approaches. One is using the inverse distance weighted approach. So we kind of count all 4 air pollution monitoring level data, and based on each subject's their home address and work address, and we'll assign, for each address the air pollution level for that particular day. And we use this kind of like all 4 and use based on the distance, inverse distance weighted approach. And another is we use kind of like a closest, which monitor station more close to your home or work address will assign the air pollution level from that particular, station. And so, the people will criticize, some, of the people might live, within that, 6 kilometers, buffer, and some living 12, some living, 50. How can you count that? So we did some sensitivity analysis by excluding people who live too far away from that. Probably our air, the exposure level is not that quite precise for those people, which see. And actually got a very similar conclusions for the study results. So this one is just published in the, I think it's January 1st, the day, they published our study. It's quite nice. And here is to show you all the mean levels, PM10 exposure levels for the pregnant women. This is during entire pregnancy, or this first trimester, second trimester, third trimester, last 4 weeks before delivery, 6 weeks before delivery, 8 weeks before delivery. So you can see this is using the inverse distance weighting approach, the average, and this one is using calculating the nearest monitor. So you can see the WHO guideline for PM10 is 20. And all the early studies, their mean PM10 ranges from 13 to 90. So that's our study. It's very high level. It's almost 7 times higher than the WHO guideline. And so here is our, the final study population used for this particular study analysis. We only included those single to live birth. It's about 8,969 study subjects, and 677 of them were preterm birth, and the rate is 7.5%, which is pretty much similar, representing the population prevalent level. And there's, rest of them all term births we include in the study. And among those, preterm birth, there's moderate preterm births, which including those 32 weeks until up to 36 weeks gestation. And those accounted for majority of them, 84. But still we have about like 15% of them is very preterm births, which, less than 32 weeks of gestation. And there's about like 185, medically indicated preterm births, and there's more than 72% of the spontaneous preterm births, which means we have no idea what's the reason for that. So here is, the final results, and you can see this is remember this is only per 10 milligrams per meter cubic increase exposure level, and you can see the odds ratio. The risk is about like a 7% to 14% increase. Mainly we see is from the very preterm birth. And for the very preterm births, it's mainly related to the last 2-month exposure is very important for them. And for the medically indicated preterm births, the entire pregnancy and the first trimester exposure are more relevant, and also the last months, but it's not that kind of like a statistically significant level. And then we also analyze the data, by the, the general recommended, we call the health guideline for the U.S. National Ambient Air Quality Standard, which is set at 150, and which is equivalent to the China's National Ambient Air Quality Standard, grade 2 level, which means they have mixed, the place with mixed, the residential area and the some kind of like a commercial area. So that's, they call it grade 2 level, and which is 150. And then we kind of stratify them, they're looking at if they're during the pregnancy, if the woman has exposed to the air pollution PM10 more than 150, and compared to the women who exposed to the less than 150. So you can see the risk for the preterm is about like 50% increased risk. And for the moderate, it's the same thing. But for the very preterm, when you're looking entire pregnancy, it's not that high. But when you're looking at the last 6 weeks before delivery, and the risk could be double. It's more than 2 times. And also the major risk is for medically indicated preterm. It's not for the spontaneous preterm. The risk is not that high compared to the medically indicated, which actually the many medically indicated preterm came from those gestational hypertension, mainly preeclampsia or eclampsia women. And actually we also looked at that data, but not published yet, and very preliminary, also showed the increasing risk related to the air pollution level. So this is another, we analyzed, trying to look at the congenital heart disease study. And right now, there's no studies have been conducted in Asian country looking at the air pollution and the congenital heart disease. And very few have been conducted in the Western country, and they provided, the inconsistent results. And from our study, we compared the interquartile range, and we kind of divide the air pollution level with the 4 levels, and the interquartile increasing, and for the first trimester and the entire pregnancy, almost highest 3-fold increased risk from PM10, and also the find during the entire pregnancy. NO2 also showed a double risk for congenital heart disease. So that's kind of the data from our own study conducted in Chinese population, and we do find this air pollution is related to the adverse birth outcomes. And here is some results from the China. We look at from the birth cohort study, looking at the passive smoking and the preterm birth, and which was published last year. And this risk, also the highest risk mainly focused on the very preterm births. We all know smoking is already established risk factor for preterm births. But in terms of the passive smoking, there's no kind of consistent link yet right now. And no previous Chinese studies have been looked at this passive smoking related to birth outcomes. And we do find that there's almost twofold increased risk for women, especially for the very preterm births. The odds ratio is very high. And also, we try to look at the duration. If you expose 1 hour or more than 1 hour per day for the passive smoking, and we find it's even higher risk. They have showed some dose response. And in general, we all know in China, the pregnant women, we are aware that smoking is not good. So in reality, most pregnant women will try to avoid, the sitting in a, area has a lot of smoke exposure. And then we try to look at it. See, among our population, it's about like roughly 25% of women reported they exposed to the passive smoking during pregnancy. And then we try to look at it, ask them, when you expose at home and or expose at other locations. And they report those, and we found actually the highest risk came from the home. So that also makes sense, right? So you at home, there's kind of like space more concise, and the people, probably your husband or your parents, the smoking in front of you, you have nowhere to hide, or probably exposed much heavier. But in public areas, so pregnant women has, they can move, they probably move far away from those, smoke people, probably has a little less exposure. So that's kind of the speculation. Maybe that's a reason, we find a lower risk among those who exposed in the other places. And then, we also look at, all the risk is mainly kind of restricted to the very preterm birth. And among the very preterm births, they also have we call the preterm premature rupture of membrane. And those kind of like with or without those rupture of membrane. And we found that the risk only restricted to those without, the rupture of membrane, and which is counted about like 3 times. I would say like 3/4 of the population, all the very preterm births. So that's that gave a hint. When we're looking at the disease and exposure relationship, we needed to go more further detail and looking at the specific subtypes. And sometimes if we mix them together, you might not find the association. So some of them not related to this exposure, but another thing. And you put them together, you will dilute those real association. So that's from our study. So I want to conclude this air pollution and passive smoking is really, really bad in China. And we also have the hope because both of them are, easy to fix, right? It's not a kind of something we have no power, we have no way to fix them. But those two, it's definitely we have the ability to fix them. And, like smoking, I like this one, smoking is not a suicide, it's murder. It's definitely murder. So you enjoy smoking, but you are really put, a lot of adverse impact and a huge hazard to other people's. Actually, when I was in China, I visited the Yale Center, Beijing, and which located in a very beautiful, the commercial building. And I was go to the elevator, and they have an advertisement. And among us, it's 3 very famous Chinese people. One is the previous minister of the Ministry of Health, and another is Baidu's director, Hong Ye, right? Zhang Hongye or whatever, I cannot remember exactly. And that's a very famous, actress. And they all said that we don't want to smoke doing the, smoking those kind of like a commercial, try to, advertise, people quit their smoke. So that's kind of the things we really don't want it, and we want to avoid. And I think, we need to advertise to Chinese government, hopefully they will put more rigorous, regulation in general population and fix those problems. So, all those studies, it's not easy, it's not a kind of very few people could able to finish up those large population-based study, we have to rely on a lot of manpower, especially, the questionnaire entry, the job, it's enormous. We took us about like more than 2 years to finish them. And also the cleaning data took us about like 1 year to clean all the data. So it's enormous work. And, actually the other day, one person, we have a job interview, can recruit another faculty member through to our department. And then he asked me about, Alzheimer's. I said, all of them has been translated in English. I said, no, it's all in Chinese. So we have to rely on people who know Chinese to, type in or entering of the data, and then we translate them, into the, English variable, and to do the conduct the analysis. So that's also a huge amount of work. And all the questionnaire I stored, in my office, we took quite a few, space also along the hallway, using the file cabinet to store them. And during the past like 5 years, I think there's also very good model, for us to collaborate with them. We all know the current funding situation is not that easy to get funding to conduct such large studies, in foreign countries, especially getting funding from the U.S. government. So we do not have funding, but they put effort, conducted such huge, large study. And we did build up this very good relationship, and they sending people come to Yale, we training them, and this kind of like a training program, and all the funding supported by the hospital. And then I convinced them, said that you training people, you need to have some, research base for them to continue working on this area. Otherwise, that's kind of like nonsense, you're training them. So after they went back to China, they will forget everything. So you have to let them continue working on those, in addition to clinical practice, also the research purpose. So they started the working on those first cohort study. All the money came from the hospital, and they involve a lot of the constant like 2 or 3 interviews, working with the pregnant women every day. So it's about like 10, sometimes 20 women deliver during the one day. They have to finish all those the questionnaire interview, and getting all the samples processed, stored into the freezer. So that's kind of all the, I can't name all of them, but you can see there's quite a lot of, people have been working with. This is a director from the hospital. He has really great vision, about their hospital's future. I think right now their hospital is one of the leading maternal and child care hospital in China. And a lot of people went to their hospital for kind of like getting some experience how they did this. Actually, when this director take over this hospital back to 10 or 15 years ago, the hospital is almost dying. Nobody go to the hospital. Their doctors more than patients. More doctors, less patients go to their hospital. It's almost dying. And then after he went there, so they kind of rebuilding the entire hospital. Right now, it's very popular. Last year, they have more than 15,000 births happening in their hospital. It's huge. So I want also to, thank many other institutions, and also the NIH, put one Cohort grant for me to, I will have the support to constantly go in there to work on this project. And also the air pollution data, it's not that easy to collect them, but I'm so grateful, the Gansu Province, the Design Research Institute of Environmental Science, they collaborated with us and provide the air pollution data, and also the environmental monitoring general stations, they did all those air pollution data. And we have quite a few other faculty members in the Yale School of Health also involved in this project. So I think that's pretty much. Thank you.
Yawei, this was really, really fascinating, and obviously you guys have found some very statistically significant outcomes in your study. One of the things I wanted to mention, though, everyone might not be familiar with the PM10, the PM2.5. You know, those of us living in China, it becomes like second nature. But can you give a quick explanation of PM10 versus PM2.5?
So in general, you know, when we're talking about the PM10, PM2.5, we're talking about the particles, you know. So if you, like many years ago, if there's kind of huge windy, we have the dust. That's kind of, we can see, right? For the PM10, PM2.5, we cannot see it. It's very tiny. And then they can, you can breathe them and they can get into your lung. And if the particle, the size is smaller, they can go more deeper into your body. So that will cause more damage. So actually the PM2.5, it's more damage, put more damage than PM10 to the human body. So that's kind of, in general, what we're talking about. And this all fine particles, we cannot really see in eye, but if there are a lot, you know, because those particles also can, you know, kind of like how to say that, kind of like stick with some other big particles together. And especially during the, you know, the like some other like so the kind of like a constitution about those particles, what's kind of inside the particle. We are talking PM2.5 to PM10. They're from the different location when you're looking at the PM10. Their contents very differently. So there could be a lot of heavy metals in there and a lot of nasty chemicals in there as well. So we just did a kind of like a pilot study in Lanzhou, and we went to the 50 different houses, and during the winter time and a heating season and a non-heating season, we collected 50 households there inside the home, the PM2.5, and we kind of like using those, you know, the fumes, and we measured the contents inside. And from the different household, their contents very different as well. And also, you know, when you look at the heating season, non-heating season, the inside, the metal, heavy metal levels is very different. Among the heating season, much higher compared to the non-heating season. So that's kind of another, you know, when we're talking about air pollution study, more in detail when people are talking PM2.5, PM10 associated with, you know, the certain human health outcome. But, you know, quite often, you know, we find from different, you know, population, we got very different results. So, you know, we also need to think about it because, you know, the PM2.5 from different locations, they have very different contents. And we might expose you to the very different carcinogens. And so that's kind of one of the reason, you know, we might see the differences between the different populations. So that could be, you know, for our future, you know, studies. We need to think about it, looking at the, you know, the sources about those PM2.5, what's the major contents in there, and from the different city, they might have the different approach to control all those.
Are there some questions? Yeah, go ahead.
We've had similar findings in Los Angeles, in our country, with the increase in air pollution and the increased frequency of prematurity. How is the Chinese government and the health system responding to this information?
So far, I don't know.
I mean, I'm so thankful that you're doing it because you're making them aware of it.
And I think that's kind of the next step. We need to do more, you know, the kind of like a news media release about, you know, those findings to let them know. And we do find that there's actually the 2 Chinese studies previously published, they already, you know, find those association. But, you know, I think there's kind of like a gap in Chinese culture and here. So often people always say that science is science, reality is reality. Nobody kind of make a connection to that. So that's kind of another important thing. So we think, you know, everything published, we need to, you know, make those kind of like a news release or something, let the general population know there's scientific evidence there. But I don't think there's right now something.
Not a lot of pushback, not a lot of cries for change.
Actually, you know, the Chinese government, they realized those, and they actually put a lot of money, gave to China's NIHS, China CDC, and also the EPA asking them to conduct an air pollution and a human health study. And actually during the past couple years, we were invited, to helping them design the study, but they kind of like not really kind of sharing their data, the results with you. And probably this is kind of like a government agency, they're more cautious about their, results, and they don't want, bring any trouble with them. So that's, a little bit difference. But I do know there's many other, like Chinese universities, they don't care. They publish quite a lot of, those studies, but it's not really draw a lot of attention from news media. So people always kind of like put more attention from the government results. They will make big sensation, always find something. So that's kind of, how that works.
Really, this research, I shouldn't say it's in its infancy, but it's still very early in China. It's premature, yeah. But it's still very early in China, and part of what's happening right now is something like an identification of the problem, codification of the problem, sort of a mapping of what's going on where and because of what. And hopefully out of this in the next several years, we're going to start seeing some policy recommendations. But there are some real challenges, especially, for example, in the area of smoking, where local economies are tied to tobacco. And there are extremely strong disincentives to make any changes whatsoever at a local level. The same thing goes for polluting industries or for the food industry, the agricultural industry as well, because China has 1.4 billion people to feed. So they need a lot of ground, they need a lot of pigs and a lot of chickens to take care of their population. And even now, it's not enough.
And also like for this early, the pregnancy outcomes, it's not, like this prematurity, it's not just affecting the, the infant mortality or something. They also linked it to the future adulthood chronic diseases as well. So that's kind of right now a lot of, we all know the fetal origin hypothesis. Many chronic diseases in adults actually linked it to when they were born, the perinatal exposures. So that's, we needed to put more attention at the beginning to prevent the future disease as well. Yes.
Oh, I was going to say, my brother travels to China quite often, and he said that the cigarette in China is different from the American cigarette. So therefore they are more toxic, if you may, the Chinese cigarette. Is that correct?
I don't know exactly.
Yeah, he said it tastes different, is stronger, and it's not filtered and so on.
Yeah, that's true.
Yeah.
It is.
Do you think the recent film or the documentary that Chai-Jing put out maybe has lit a fire amongst, or given a voice, kind of outside academia, and do you think that might have raised the profile, even though I heard it got pulled down shortly after, but I think a lot of people have seen
it's
it.
about like after 1 week they put down.
Right, but
when I went to China, a lot of people were talking about that film. And right now, I think a majority of people in China, they already realize that. I think the government also talking about that. So they realize this is a very important issue. Actually, people are working in the environmental health science department. Right now, they have a lot of pressure. And the new director of the EPA, China EPA, just, they changed this guy came from, I think, Tsinghua University, right? It's president of Tsinghua University, or from which university, yeah. It's, he's a new guy, and he also kind of has a, interview, people are talking about those under the dome, the film, and he acknowledged that. I think that's very important, Chinese government acknowledge that, and I think right now they try to do some work to really give people more healthier air. That's what they do.
And a last question.
I I was just curious, you mentioned that June, or very soon, there's gonna be this regulation, no smoking public.
Yeah,
What's
that's in Beijing.
in Beijing?
Yeah,
Okay.
in Beijing,
What-
they said
what's-
it's June, they said it's June. Anything, they have a roof, under the roof you cannot smoke.
But
The
if
area,
you
that's
are
kind of the
caught
regulation.
smoking, what's the fine or what's the
I
cost?
really don't
Oh,
know.
okay.
Unlike, yeah,
Oh, sorry.
you go ahead.
One of a very practical question is, because you're talking about if the people sitting in the indoor space actually is more toxic because there's a very minimum. I'm not a scientist, but because in your case, then there is like a 10,000 male, female, and then to have a blood test and something. Is that how you have a
Yes.
Sure.
Actually, there are some of the, Chinese visitors, when they went home, they bought those air filters from America, bring to China, use them. So I don't know how that useful it is, we really don't know yet. But I do know there's one study right now, the Brian leader from the School of Public Health Deputy Dean, and he has a big interventional study, and for asthma people, and they do using those kind of like air filter intervention, kind of for asthma kids. In their home, they probably install this kind of air filter and make the air more cleaner or something kind of like that. He's working on that issue. And this is an interventional study. They will find out whether those kind of like air filter, clean air might do good for the asthma people or not. So that's kind of my study. I do know this on the field.
With the feedback to your awareness of that kinds of air pollution issues, actually, I think everyone know that. I mean, that is a very serious issue, even though you didn't credit that kind of amazing number. But the problem is something people maybe believe, some of the media like advertising, like they just wear on some of masks, they think that would be good. Like you go to Beijing and then to take a look at the wrong running competition, some people really wear on the mask, but actually we know that the mask is useless. If you study something like a safety regulation, that's totally useless.
But for the air pollution, there's no way for individual to really do something.
Yeah.
And I think it's government job, they need to have some policy or do some action, kind of like shut down really polluted, those industries to release less air pollution. That's kind of the major thing they need to do. So you cannot prevent, you just breathing every day. So there's no way for you to really, for individual to prevent that.
One last one, really quick.
And as far as the whole process goes, now that the results are published or are about to be published and make their way through different journals, what happens next? Whose job is it to then transfer that information to the public? Is that your job as researchers or?
I think it's, I could do some, but I think the news media is very important too. And sometimes, the good journal, they often have the kind of like working with the news media, they will recommend some, publication. And I think the Yale news media, if they're really interested in this topic, they could talk to me and we can work together and write up something, very more, the readable for general audience. And there's a finding. We're not kind of exaggerating anything. So this is a scientific evidence, and we could put on the, the news media or something. That's kind of the, both sides. Sometimes, probably we are kind of more, kind of focused on the scientific side. We're not really kind of put a lot of effort, so too many things to do, writing grants, writing papers all the time. Have no time to working with the news media to please publish those one, there's kind of like we usually don't do that. That's kind of academia people sometimes.
Yeah, Chai Jing's work, if some of you have seen it, she is like the Steve Jobs of environmental research in terms of her presentation style and ability. It's really fabulous. So if you look up under the dome, you'll find the TV series, I'm sure.
Yeah.
But you'll also, maybe put China at the end, and you'll find her presentation.
It's on the YouTube. I think you can get it from YouTube. It's still available. Yeah.
Well, Yawei, thank you so much. This is
My pleasure.
really interesting. It's such a timely issue for China, and the work that you and others with you are doing is incredibly important. So we just want to say thank you.